Ulta.
Okay. Good morning, everybody, and I thank Dr. Tanuja for including me and giving me the privilege of presenting in her instruction course. Now, optic disc is the seat of damage in glaucoma, and we do have, all of us, we document the disc in some way. We show NFL defects, we show notches, but why do we need optic disc photography? So, and I have seen across cities, many clinics are very well equipped with OCT perimetry, but the facility for a good fundus photograph is not there. And many people do ask that in this age of OCT, why do we need a disc photograph? So for me personally, one is that taking a good disc or a fundus photograph is a work of art. And moreover, however, a picture is equal to 1,000 words. So the little nuances which a photograph, a good photograph brings out, like a pallor only in certain areas of the disc, the way the blood vessel curves over it, all this can be seen only in a good disc photograph. So that's why, and plus in glaucoma, it's not only diagnosis, it is progression. Now, none of the methods we have for progression are foolproof. So we need every information like perimetry, OCT, disc photographs for us to assess progression. So in that, and studies have shown that a good comparing good disc photographs is a very, very important method of detecting progression. So as I come to, with this fact, now this is one person who was labeled as physiological cupping in 2013. Pressures were 22, 23. Fields are normal. And slowly we took, every year we took disc photographs, and you can see that there is a, if you see this, there is a subtle difference where this area has thinned out. So this gives us an indication that yes, the medication is not enough, you need to, but again it is over a period of 6 years, but glaucoma is a slow disease. It is never in any hurry to progress in primary glaucomas. Now again here, now this is reversal of cupping which you can detect. Now this is a person who, a lady, 45-year-old lady, in December 2018 on medications, she had an advanced field defect. She was controlled but not very well the way I wanted. So I went ahead and did a trabeculectomy, and post trabeculectomy, her disc picture changed. So even that you can document if you have a good disc photograph. Third is, the disc may look normal, but if you see there is a very subtle nerve fiber layer defect which is seen here, and those nerve fiber layer defects are not very visible clinically. They are visible only when you take a good photograph. Again, these are nerve fiber layer defects. This I could pick up on because it's a very clear-cut NFL defect. It was seen on slit lamp. But if you do an OCT did not show the inferior nerve fiber layer defect because it does not reach up to the tip. So this is one more reason. Second is, in this particular patient, OCT is going to be useless because there is peripapillary chorioretinal atrophy. He's a high myope. You don't know whether it is glaucoma, whether it is normal. Of course, the fields will help you, but discs also are an important parameter. Again, here, there are, if you see this disc photograph or the fundus photograph, you will find there's a big nerve fiber layer defect, there is a corresponding field defect, and maybe 30 years later, if I had seen, if he didn't have this, if the person does not have his old reports, we will say he has normal tension glaucoma, and we will be debating whether to treat or not to treat. But however, you have to remember that this disc has had a history, and he had an NAION, but it presented after it resolves, it looks different. So this again you can document only if you take a good fundus photograph. Now we have, how do you do it? You have traditional fundus camera, and the red cams. You have slit lamp based imaging techniques where you put a camera onto the slit lamp, and you have a monitor. And now the flavor of the season is smartphone based photographic techniques. First, I am talking about fundus camera, everybody knows. Slit lamp techniques, yes. But however, what does a smartphone fundoscopy do is, it uses the good cameras, and second is you align the camera of the smartphone to the optic of the slit lamp with the adapter. This is one thing you should not do. Earlier, you remove one eyepiece of the slit lamp and the assembly of the smartphone is attached, is inserted, but however, it spoils the microscope. Do not use this. There are better ways available. Now, this is one video I will just show. This is a universal adapter and all these are available at the, there is no commercial interest I have. This is just what I have seen and used, and that's why I'm sharing it with you, that you attach the camera here. How do you do it? Not everybody wants to buy an expensive fundus camera, and that is why these are methods where you practice them and you are able to get good fundus camera. So this is the adapter, and the adapter now you align with the camera of the mobile. And this green ring is an adjustable ring, and it will fit onto the optic of your slit lamp. I'll just fast forward it. You tighten it, and yeah. Now the assembly is ready. He's increasing the size, and this is how it fits onto your slit lamp. So you can take a good, this is however very good for, this is a universal adapter, again available on Amazon. This is for $900, and you can fit it over your slit lamp. This is, however, the slit lamp methods, you can take good anterior segment photographs, but fundus pictures, I found it a struggle. So this is one assembly where the slot, it's a full assembly with your mobile here, and it fits onto the slot in your slit lamp. This is how it looks, and I'll just show you how you can attach it. What is it? It uses your 20D, which you use for indirect ophthalm. It's any regular Vogue 20D which is used, and that you fit onto the assembly. You fit your slit lamp on the other end of the assembly, and that's it, you are ready to go. So these are, and this is again available. This is taken, last year I had taken at the AIOC stall. I asked him to demonstrate it, and that's it. There is one more method. These are companies which you have ready-made, these assembly is ready-made, and they give you a dedicated smartphone. So and they have an app. When you switch on the app, all the flash, the intensity, the resolution, everything is adjusted. So all you have to do is click. On the other methods, you need to learn yourself how to do it. This is handheld. This is also available. Again, 20D is here on this side, and here is where you put your smartphone, and in a dilated pupil, you put it near the patient's eye and you can take a photograph on your smartphone. This is a camera with, this is what I have used. This is the MII. Again, I'm specifying I have no commercial interest. This is where you use your 20D. This is where you put your fundus, you put your camera, your mobile, sorry, and this is how you hold it. And this is, you can take a good disc photograph. The periphery of the retina also you can see with this. You can have a nice wide angle view also by adjusting the magnification at which you are taking it. And this is a person who had a detachment. Now it takes a little while to get used to it. The way you took time to get used to doing an indirect ophthalmoscopy, it's the same thing. But so it's a patient with a detachment, you can even record images, not only still images. Now, having come to that, so my topic is pachymetry and disc photographs. So this is how disc photography is important and how you take it. If you are determined, or if you do not want to invest in a fundus camera, spend a little more time in these devices and you can have good pictures also. Coming to pachymetry, one thing, the OHTA study actually brought forth the important relationship between IOP and corneal thickness. I have only two things to say about this. One is that there is ultrasound pachymetry and there is optical pachymetry. Both are different and you cannot extrapolate results. Optical pachymetry is a little thinner as the results, the measurements are a little thinner as compared to ultrasound pachymetry. However, most of us use ultrasound pachymetry in glaucoma patients. What I need to, over the years, so many studies have been done trying to find a correlation between corneal thickness and how much you have to adjust the intraocular pressure. But you have to remember one thing is, so, and there are some softwares which give this ready-made thing. 480 microns is the corneal thickness, correction factor 4, so the corrected pressure is 23. There is no such formula. So I want to re-emphasize, you can only, there is no conversion formula, you can only say this is a thick cornea and this is a thin cornea, or this is a moderately thick cornea. And so you know that thick corneas overestimate IOP, you cannot add any number, and thin corneas underestimate IOP, you cannot add any number. That is the take home for pachymetry. And the take home for fundus, for the disc is that fundus pictures paid rich dividends and are worth the time and money also. It requires practice and persistence. If you are not, even in a traditional fundus camera, the settings you have to readjust because you need to bring out those nuances. That is what I have done. And if you are using a non-fundus, you are using your jugaad, then real motivation to use it in a busy OPD. 20D based gives better fundus pictures, and it's cheaper, cost-effective, portable with the newer fundus, with the newer mobiles. And I feel currently you need to work a lot on it. It is, you don't get as crisp images as you get in a fundus camera, but as our mobile phone cameras become better and better, it will become as good as a fundus camera, but you need to keep on learning. Thank you all for a very patient hearing.
Thank you, Dr. Priti. And I think her fundus photography modalities, all of us have enjoyed very thoroughly. Thank you so much. Okay.
I was telling that my PG is that out of 5, 4 they said they find it.
Which one?
So I say take photograph, we have a good camera and all that, and then we will talk about doubtful and other things. So it is very important that if you have a device, you can take a simple plus photograph and keep on seeing them and keep on recording them really, and then compare with any other things. So this is what, and any of these things available here?
All are available here.
Here?
At the AIOC.
So they are available.
All, every single thing.
Thank you. I think you know very good.
Good. Or repair के लिए yes ma'am.
Cups and just starting treatment is not good at all. That 22 tension and starting treatment.
कुछ प्रॉब्लम था क्या वीडियो में?
कुछ नहीं था, वैसे ही आते. वीडियो नहीं है इसमें. रिपेयर कर दो कोई दिक्कत.
Very good. Very good.
Thank you, sir.
Read some content.
No, it's okay. You are right.
If anybody in the audience is doing something different and taking good fundus pictures, even they can share it till Dr. Tanuja is loading her
इसमें नहीं आ रहा है.
presentation.
HDMI.
Sure.
स्क्रीन बड़ा नहीं हो रहा है एक्चुअली मैं रिपेयर नहीं मांगा था इसलिए
अरे नहीं, वो तो
स्क्रीन पे आ जाएगा बट
How do you explain that the size of the disc has decreased? What is cupping? So sorry, the cup has decreased. What is that? How do you explain
Reversal
it?
of cupping.
Reversal of
Gliosis.
cupping.
It is gliosis. It is not functional neuroretinal rim
Because we
which
have-
covers it. It is gliosis, and it is seen mostly. Earlier, it was associated with when you treat a child, the
HDMI.
cup disc ratio becomes smaller. You know, it becomes normal. But we have seen it even in adults. The pallor will not go away. The cup disc ratio will go down, and it is with gliosis. The perimetry will not improve. It will stay as it is. So it is just the structure changes because of gliosis. But however, I have seen it occurs only after you have operated, and not when you have. All these years she was on medications, and pressure from 50 went to 25. But it did not result in reversal of cup disc ratio. But when I operated her, the pressure went to 10, 12, and that caused the reversal of
So
cupping.
what
there
is
is some difference.
so what is the significance of decreasing the size of cup?
Okay, it is one way of documentation. And
It's just a documentation.
It's documentation
Doesn't
and-
have a clinical value.
No. Only if the
That's-
patient
that's-
goes to some other
because
place, they will not think this is glaucoma.
Okay.
Got
It
it?
doesn't have a clinical value.
No, in my, because I know what it was earlier, it did not have a clinical value.